And now it's time for Family Health Matters with your host, Miss Wendy Bridgers, First Lady, RN. She is a registered nurse for over 35 years, and she has graduated from North Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born-again child of the Most High King.
Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are live today on the Zoom and on Facebook talking about some community concerns and issues. So I welcome you to Family Health Matters on Awesome Radio 106.9 FM. We are here every Thursday from 3 to 3:30 p.m. And we invite you to join us each Thursday because we try to bring lots of helpful information that's going to keep our families and our communities well. Today, I have a special guest with me, my colleague from East Carolina University, Dr. Renee Spain. So welcome, Dr. Spain. May I call you Renee?
You may.
Okay, great.
I'm only Dr. Spain to my students.
Okay, well, great. We've got a really good topic today, something that I have just since COVID has been going on, it has been in the back of my mind and wanting somebody to talk about it. I've had some friends and who's been asking me about pregnancy during COVID times. So Renee has a wonderful background in midwifery and all this wonderful stuff. So I'm going to let you introduce yourself, and then we're going to jump into our topic today.
Okay, as Ms. Bridgers said, I am Renee Spain. I'm a certified nurse midwife, and I have been a certified nurse midwife for 19 years, which is hard to believe. So since 2001, I finished my midwifery degree at East Carolina University. We have the only midwifery program in the state in 2001. And when I finished, I went into private practice, started a midwifery service within a already established physician practice here in town. Did that for a couple of years doing full scope. So I saw women in the office, did prenatal care, did wellness exams, and caught babies, and worked a lot of hours, and decided I needed to do something so that I could be at home with my children a little bit more rather than being gone every other day. And had an opportunity to come to East Carolina University. And when I came in 2003 to ECU, I came as the lead clinician for our faculty practice. In order for us to have a program, we have to have a faculty practice site. So our faculty practice site is at the Pitt County Health Department. So I went out there and I did prenatal care and wellness exams 5 days a week until 2015, when I moved over into academia and left the health department full time and came over to teach. I still do clinical practice because that's part of what we do as midwifery educators. So I am at the health department 1 day a week seeing patients, but I don't catch babies anymore.
Well, that's
bad, but at least I get to sleep at night.
Oh, yes. And, catching babies are something special. I tell you, that's really awesome to see a life, just that's born and healthy. So what we wanted to talk about today, Renee, is I know there is people that's out there that's trying to decide, young parents trying to decide, should I get pregnant during this time? Or if I'm pregnant, what's going to happen? There are a lot of nerves, a lot of anxiety that's going on with being pregnant during COVID-19. So I wanted us to just share a little bit today, and with your expertise, just help us understand a little bit about how being pregnant during this time can really affect you, and just some good, solid information to help our families.
Okay.
So go ahead.
Go ahead.
I'm sorry.
No, go ahead.
I was just going to say, I guess one of the big questions would be, is that should people really want to get pregnant during this time? What do you think?
Well, I think COVID should not impact your decision to get pregnant. There's so many other things that need to impact that decision. COVID's just one of the many things we need to talk about. But we need to make sure that, one, you're ready to have a baby. And that means that you're physically well and prepared to have a baby. So are your immunizations up to date? Are you taking a multivitamin with folic acid? Because if you take that multivitamin with folic acid prior to conception, that helps to decrease the risk of specific birth defects, like spina bifida and anencephaly, which are defects in the baby's brain and spine. Are you healthy? If you have a chronic illness, is it well controlled? So if you're diabetic or you have hypertension or high blood pressure, is that well controlled? What is your weight like? Is your weight in that normal range, or are you working to get it in that normal range? We know that women who are underweight and women who are overweight have more risk in pregnancy outside of COVID. So there's a lot of issues other than we have a pandemic going on that need to influence that. Do you have a stable social situation? Is your partner, whether that be your boyfriend or your husband or whomever that is he committed to parenting with you? Do you have stable finances? Kids are expensive. They are expensive little critters. So how are you going to afford to do this? Are you in school, and is being pregnant and being in school going to be something that you can do? Because those are both very demanding roles. So, if you've got all the rest of it worked out, this pandemic shouldn't influence your decision to get pregnant.
Well, if you've got all that worked out, you ought to go ahead and get pregnant regardless.
Right. So but there's so much more to think about when we think about, do I want to have a baby, than just, do we have a global pandemic? So if you have questions, talk to your healthcare provider. When you go in for that wellness exam, that's part of what we can help you do. We can look at all of the things in your medical history and say, oh yeah, I see here that we don't know if you are immune to chickenpox, or we don't know if you're immune to rubella. Let's go ahead and get those vaccines updated. And then let's talk about getting pregnant after we do that. So there's lots of things, and having that conversation at a wellness exam is really a good place to do that.
Okay, so getting those basics done before we even concern ourselves about the COVID.
Right.
Okay? So now we've done those things, and our partner, we're ready, and I'm pregnant. Not me.
Oh my, not me and you.
But now the person is pregnant. Now, how do we stay safe?
So staying safe during COVID for pregnant women is much the same as for the rest of us. Mm-hmm. The CDC has put out some really nice guidelines that help us know what things we should and should not do. And all of those things that are for non-pregnant people are also for pregnant people. So making sure that you're getting good information from a reliable source. The Centers for Disease Control is really the best source of information. And that's where your healthcare providers are getting their information that they're sharing with you. And that information is updated regularly so that we can make sure that we are giving you up-to-date information about, where are the hot spots and what are the things that we need to do? And are there new medicines or new treatments out there that are effective? Don't skip your prenatal appointments. That's a huge piece of being safe, because we need to make sure that there are not issues with your pregnancy that we need to address. Limit your interaction with people as much as possible. If you're going to go shopping, that's fine. Wear your mask. Make sure you have hand sanitizer and you're washing your hands. And don't go at peak times. Go grocery shopping early in the morning at 8 o'clock. Many of our stores have special hours for at-risk populations, and being pregnant is an at-risk population. And that's part of that is because when you're pregnant, your immune system doesn't work as well. So you're a little more susceptible to things. And so a lot of our stores have put into place hours of shopping that are for specifically vulnerable populations like the elderly or pregnant people or people with chronic disease that make them more susceptible. So make sure you're taking advantage of that. Make sure you got your medicines, at least a 30-day supply. If you can get a 90-day supply of your medicines, So you're not having to go to the pharmacy quite so frequently.
Okay. That's good. That's good. And I like what I guess one of the things too that people have asked me about is visiting. I know, we're supposed to, everybody's supposed to stay home as much as possible. But when you're pregnant, people want to come see you. People want to touch on you. For some reason, that baby bump, everybody wants to touch.
Everybody needs to rub that belly.
So what are your suggestions?
Well, I think that we need to do what the CDC has told us and stay socially distant as much as possible. Does that mean you can't get a hug from your mama? And this hits really close to home for me. I'm sorry. My daughter just had a baby. So we have lived this experience. And it was tough. It's tough. And especially for our folks who are already having issues with depression, anxiety. Make sure you talk to your healthcare provider, especially if those feelings get worse. Don't isolate yourself completely. You can't do that and function in this world. But be careful who you're around and who you're close to. Don't get around sick people. If they're sick, don't let them into your inner circle. If they're not willing to wash their hands and wear a mask, then just ask them to stay away. And kind of put some of those barriers in place for yourself, but you got to kind of decide for yourself what's okay. Now, if you guys want to sit on the back porch or on the front porch and visit 6 feet apart, I think that's okay. We're outside, you've got lots of ventilation, and that's an okay thing. But you have to use a little common sense. It doesn't mean you have to lock your doors and close your windows and never see anybody, but just being careful about who you're around and when you're around those people and how you're around those people.
Yeah. And I think too, Renee, when you were talking, I thought about the fact that sometimes, people have a hard time saying no, or, I really don't want you. Sometimes it's important if you have somebody that's a support person.
Right.
Say that hard no for you.
Right. And
that's you feel bad.
That's very true. And we tell pregnant women that in the hospital, especially if there's somebody you don't want in your hospital room, it's okay. The nurse is glad to say, I'm sorry, you can't come in right now. Yeah. And you need somebody like that in your life to be able to say, I'm sorry, now's not a good time for you to visit. We'll have another time to visit. And we tell women that for postpartum as well. When you have just had a baby, you're tired. And the last thing you want to do is entertain people. And so it's okay to say, I'm just not up to that right now. Or have your mama say it, or your partner, or your husband say, I'm sorry, right now we're just not comfortable with having a lot of people in our house. And that's okay. That's okay.
And I think people need to hear that's okay. One thing that you said, and I know, gosh, time is just running so fast, but one thing you said that really stuck with me was the fact that don't isolate yourself.
Right.
Because with being pregnant, if I remember years and years ago, your hormones are already going up and down and fluctuating. So you have all of these mixed feelings going on. And it's hard to control.
It is hard to control.
I like the part where you said that you need to make sure that you've got somebody there to be supportive of you.
And that might be your mom, it might be your sister, your grandma, your aunt, it might be your best friend, might be your pastor, your minister, your partner, whomever that is, but make sure that you're still staying connected with friends. And you can do that in a lot of ways. You can do what especially our young moms are really into Facebook, and there are lots and lots of pregnancy groups out there on Facebook. So making sure that you're connecting with those folks. If you've got a way to do, like we're doing Zoom. Zoom is a great way to connect with folks and to have those groups and have that interaction. You can make sure that you are, pick up, I know this is an old-fashioned way, but pick up the phone and call somebody, not just text them, and actually talk to a person. That's something I think that our young folks don't do a lot of, but actually connecting with folks. Call your grandma and talk to her. She may not text.
That's right.
Phone.
Yeah. And then that gives you that support that, that actually being able to hear somebody else's voice. Now, one of the things too that we talk about is, trying to look at baby showers. Now, I've seen some creative people with baby showers. Anything that you want to, in your experience when your daughter was having her baby?
We all want to have a shower. We all want to bring stuff for the new mom, and moms want to be able to have that and have that nice party and, have cupcakes and decorate and have all those snazzy things. And, right now the governor says no more than 25 people, and you really want to still be a little distant. So there's lots of things you can do. You could do a Zoom baby shower. I have a colleague has a mother who's having her 87th birthday party over Zoom, and they're all tuning into Zoom and they're celebrating that way. So that's one, have gifts shipped to the new mom's house, have a Zoom session, let her open gifts and everybody join in. We drive-by showers, and that's for Anna.
Right. Well, I was going to just, you can be creative, but let's flip back a little bit, and because we're going to have some showers and people are creative, but I want to talk a little bit before we run out of time about people now with the visits, the appointments you mentioned earlier. What about the telehealth visits? So
and the Society for Maternal Fetal Medicine and ACOG, which are the two big OB guru people in the medical field that know all the stuff. Their recommendations have been to space those appointments out that are in person and do some of those over telehealth if you can. Now, there's some folks that we can't see over telehealth because we actually need to put our hands on them.
Right.
But we can do some of those visits. So, for example, in our clinic, the initial OB visit is usually with a nurse. She asks 4 million questions for history and answers questions. We do that as a telehealth visit now, so that she's not having a face-to-face visit with the client, but we're actually doing it on the phone. We ask all the questions, the client gets to ask questions, and then we bring them in, draw their labs, and do their physical exam with a provider. And then if everything's okay, you may not see that provider again for 6 weeks, but we may do a telehealth visit in between where we're using a platform such as Zoom, but it's a secure platform to be able to see that patient and do some interaction. There's some things we have to do in person. We have to do ultrasounds. We have to draw labs in person. And we do occasionally need to put our hands on you and measure your belly and listen to your baby.
Right.
But you can have a variety of those platforms.
And if there's an emergency, don't hesitate.
Please don't hesitate. Please, if it's, during office hours, please call your provider. If it's not during office hours, it is perfectly safe to go to the hospital. Depending here in Greenville, if you're 20 weeks or more, you go to labor and delivery. If you're less than 20 weeks, you go to the emergency room. But there are precautions in place to make sure that everyone is safe.
Okay. And just really quickly, because we've got almost just a little less than 5 minutes to go. But now suppose somebody thinks they're pregnant, but they think they may have had some contact with somebody who has tested positive for COVID or may have some symptoms. Anything that they need to be overly concerned about?
Well, the first thing they need to do is contact their provider and get tested. And that provider, whomever their provider is, will give them guidance as far as how that testing gets to be done. For us, we have them come to the parking lot and we test them in the parking lot. We don't bring them into the building and do that test. And then you do the quarantining. If you're asymptomatic for 10 days, if you're symptomatic, you're going to wait 10 to 14 days after resolution of symptoms or after your positive test.
Okay.
But
so that Oh, go ahead. I'm sorry.
Please call your provider and have a discussion with them, because what we don't want to happen is for you to get really sick and for us not to be able to intervene and know that you're sick and be able to provide all those safeguards for not only you, but for all the folks around you, for other children in your home, for other people in your home, and for the other patients and healthcare providers that are going to be around you.
Okay. And that doesn't necessarily mean that it's going to affect the baby.
No, we have not seen any transmission from mom to baby in utero. There have been a couple of case studies where there have been some, and they're not, we don't really have good data, but potentially some transmission in some really preterm infants, but, not really sure exactly that mechanism. Okay. So no, right now, no evidence that there is transmission from mom to baby while the baby's still inside. Okay,
good. That's good to hear.
And the other thing is it doesn't appear to be transmitted through breast milk. So you can still breastfeed your baby.
Okay, good. Any precautions around the house the mom should take as far as cleaning and disinfecting?
Well, just what you would usually do, making sure that you're cleaning surfaces that are high touch areas, doorknobs, light switches, drawer pulls, those kinds of things. Making sure that you're washing your hands. You've got soap at every sink in your house so that you have an opportunity to wash your hands, and wash your hands frequently, especially once you bring that baby home. And that's true whether we have COVID or not. Before anybody touches that baby, they need to wash their hands. Don't be kissing all over the baby's face. I know we like to snuggle and kiss on them, but stay away from the baby's face because that will decrease transmission of not just COVID, but other viruses. Remember, this baby doesn't have a really well-developed immune system yet.
Great. Well, now we're down to just the last 2 minutes. So a chance, if you really, just for just a minute, if you really could share anything particular that you would, because I think I'm going to have you come back and we're going to talk about maybe part of the delivery part and or maybe some of the hospital stay. So we have to do that, just totally focus on that. So really quickly, just 1 or 2 things that you would just share before we get ready to go.
Stay away from sick people. Make sure you keep your prenatal appointments, whether those are in person or by telehealth. And make sure that if you think that you have been exposed or if you're having symptoms, let your healthcare provider know so that we can do our very best to take care of you and make sure that you and your family are safe.
Okay. So yes, we can have a baby during
this time. We can have a baby during this time.
Deliver. You're an expert on it. You're with new grandma again. So
I am.
Things went well.
They did.
What's her name?
Her name is Emery.
Oh, okay.
Emery Louise.
Oh, wonderful. Well, Renee, thank you so much for coming to be on the broadcast today. You have shared some very valuable information with us. I always appreciate you have taken the time to do that. And again, I'm your host, Wendy Bridgers, and we are here every Thursday at 3 o'clock from 3 to 3:30 on Awesome Radio 106.9 FM. And when we get off, I'm going to talk to Dr. Spain to see if we can convince her to come back maybe next week and we do a part 2 of this segment, and we can talk a little bit more about actually what we're going to do when we're getting ready to go to the hospital. Not me necessarily.
No, not me either.
What we would do to prepare to things that, you need to watch for, and even maybe have, maybe by then I may have some questions that some people may ask about that we can have answered about what should they look for when they get ready to go to the hospital. So again, thank you so much, Dr. Spain, for being
You're quite welcome.
You stay safe and stay healthy and enjoy your grandbaby.
I am enjoying her.
Tell her we said congratulations.
I will. Thank you so much.
All right. You have a great evening. Right. Thank you, everybody, for joining us for Family Health Matters. And again, I'm your host, Wendy Bridgers, Awesome Radio 106.9 FM.